So are we ready? Okay. All right. So we're good. So we're going to go through all of the different motions with active assist and then isometric and isotonic. So for scapula, we've got scapula protraction or retraction, which is that forward backward motion. So for active assist, I'm just going to say, Andrea, I want you to push forward. All right. And now push back. Bring those shoulder blades together. And we're doing this together. You do as much as you can. All right. Good. And this would be for somebody who, as we go through the active assist, would be at like a 2 if we're working at gravity eliminated. So at 2, you could do gravity eliminated, or against gravity, we could do some active assist. If they're at a 3 and they have full range of motion, we would want to do at least some active range of motion to get to strengthen that because they have full range. So that's our protraction, retraction. Elevation, depression, we don't do a ton of active assist, but we can. So that's bringing those shoulders up and then down. So I'm gonna kind of grab that inferior angle here. And Andrea, when I say go, we're gonna lift that shoulder up to your ears. Good, and back down. And back up, and back down. So that's our active assist. Isometric, remember when there's an M, we don't move. So I'm just gonna say, Andrea, I want you to push against, don't move that shoulder, just kind of push against my hand.
Going up?
Yep, go up. Sorry, I should have said that. There, I had to move it over. So she's pushing against, she's contracting, but she's not actively moving. All right, and you can relax. And so isotonic is movement, right? So when there's no M, we move. So I want her to go up. So I'm gonna say, Andrea, push against my hand. When I say go, go. And I'm giving her resistance, but I'm having her push. And if I were gonna do that for depression, then I put my hand on that inferior angle. And when I say, put it up for me again. Oh, it is up, okay. All right, ready? Push down, 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 down. That's really hard to do. I didn't really do a very good job there. But mostly you're gonna be doing elevation. So protraction, retraction, if you're doing isometric, I'm just gonna hold here, push against me, and I'm not gonna let her. All right, isotonic, I'm gonna say push against me. So, sorry, forward. There we go. There we go. So same thing that was protraction, so retraction, push against me. So getting that manual resistance against. So for isometric, just push. I'm not gonna let her. She's pushing, 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 but I'm not letting her move. So that is your scapula. You're not really gonna use any weights. Typically, if you're doing scapula strengthening, you're gonna mostly be using that manual resistance. So let's do, for the rest of these, let's do active assist, and then I'll come back and then do the isometric. So for shoulder, we've got abduction, adduction. So you can do this depending on your positioning with her arms flexed if that feels better, or you can have her arm out like you would range of motion. But Andrea, with your thumb up, just like we have it, when I say go, I want you to bring your arm all the way up next to your ear. I'm gonna help you, you just get as far as you can, and then I'll help you get the rest of the way, okay? All right, good. And now we're gonna go down to your side, and again, usually they don't need a whole lot of help with adduction, but just kind of bringing it down. And then now in front of you with your thumb up, we're gonna go up to the sky again, and I'm gonna help her. Make sure we get up there, and then we're gonna come back down. And then we're gonna come out to the side for some internal, external rotation. So with your elbow bent here, this elbow's gonna stay here, but I want you to bring your thumb back, like you're hitchhiking, and then just bring your arm down as far as you can, okay? So good, so ready, we'll go up, 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 and down, 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 down. And up, 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 and down, 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 down. So helping her along the way. And then horizontal and adduction, we've got our arms out here, and we're gonna go across your body as far as you can, and let's come back out. Let's go across your body, and come back out. All right, relax that arm. We've got elbow flexion extension next. So, all right, Andrea, when you're ready, I want you to try and touch your shoulder, and I'm gonna help you if you need some help, okay? and out. And let's do that a couple times. So you guys know your flexion extension. We're just kind of helping them through that motion. All right. So supination, pronation. You can just kind of hold your hand sometimes or kind of support them here. All right, I'm gonna have you put your palm all the way down to the floor and all the way up. And down and up. And obviously you would provide that education like I did at the shoulder, but you don't need to do that every time. If you're just moving down the joints, you just kind of, okay, now we're gonna do this motion, and then you help them out. And then flexion, extension of the wrist. You can do it gravity, against gravity or gravity eliminated, but we would just have them flex that hand and bring it out. Good, and if you were doing it with wrist extension, kind of in against gravity, you could do it this way. So I probably have a table, just like you guys do your range of motion measurements. If you're working with somebody on this, they're gonna be like a 2 or below, so it doesn't matter to me if you're gonna do it against gravity or gravity eliminated, either way. Whatever works in your treatment session, the best is gonna be your best choice. So then radial and ulnar deviation, hand flat. All right, we're gonna move to the outside and the inside. So I could do it this way if we're at a mat like this. If I was at the table, I could have that washcloth and just kind of on the top, kind of move that hand back and forth. So, and then finger flexion extension. You can do this all at the same time. So just kind of grip those fingers or like this in the fingers, and we're gonna make a fist. And then we're gonna come out. We're gonna make a fist, and we're gonna come out. Good. So that is active assist. So for isometric, again, no movement. So at the shoulder, at the shoulder joint. So if we're gonna do flexion, I would just have her kind of out here. All right, I'm gonna push against you. I'm gonna try and push you down. Don't let me push you down, okay? Good. All right, now if I want to turn that into isotonic, all right, push my hand up, Andrea, so I'm giving her some resistance to move against. I can also give her a hand weight. All right, with your thumb towards the ceiling, I want you to hold on to that and bring that up as high as you can. Good. All right, one more time. All right, good. So abduction, adduction. All right, so I'm gonna have you bring your arm out to the side for me, kind of up to the shoulder height here, and now I'm gonna try and push you down. Don't let me, just hold it right there. Hold, 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 hold. All right, this time, grab that weight and just bring it kind of up to your ear. Good, and down. All right, and down, good. And of course I could have my hand there for manual resistance. You could use these with TheraBand. For the video, we're just using the hand weight for simplicity. Horizontal ab and adduction. So I'm gonna have her bring her arm out here. I want you to try and push your hand in for me. Push, 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 push. All right. Now I'm gonna have you put this in your hand and bring this weight right across your body for me. All right. And while you've got that arm out there, all right, I'm gonna try and have you, so this is external rotation, isometric. All right, push against my hand. Push, 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 push. Good. Internal isometric, push down. All right, now this time I'm gonna let you push me away. So push me away, pushing down. There, you probably would wanna, here, let's try that one again. I'll support you. There we go. So that's a little bit awkward for her to do that, so I have to put some pressure there. I could give her the weight to do this. Internal, there we go, external, good. You could do it down here, internal, external, so she's gonna be limited, but that's okay, we just go through a range. Sometimes that's easier for patients for internal, external, they can't get that shoulder up. So that would be an acceptable option. Flexion extension. So isometric, all right, push towards your head. Don't move me, good. Now I'm gonna make it isotonic. I'm gonna have her push against, push, 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 push. Good. I can also give her the weight. And good. So for extension, I'm gonna have her kind of here. All right, push against me, push down, push, 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 push. She's trying to extend that elbow. She can't. And now I'm gonna let her make it isotonic. Good. So technically, yes, this is flexion and extension. If you specifically are asked to do extension, I would want you to maybe do it out here because gravity is kind of helping this way. So if you are working on extension, let's have them go out like this, or you could do that manual resistance as well. All right, so wrist flexion and extension. So here, I want you to push my fingers, push against my hand, good. And now push this way against my thumb, good. All right, so this time I'm gonna let you move, push my hand, good. And now push me back, good. I could also give her a 1 pound weight or like a 1 pound wrist cuff and have her go in and out, good. So if she's at a 3+ where she can do some resistance, we could go against gravity for this one. Good. All right. And then ulnar radial deviation. You just kind of would push out here, push against me, good. Now push against me with your thumb, and I would probably want her at a table, but for the sake of just the video. So I could have her push me this way, good. And now push me this way. All right, I could have her hold this and I'd have her on the table and I'll bring that thumb in and out. Good. We could do it against gravity. You wouldn't really do ulnar against gravity because that just would be really awkward. You'd have to have them laying down. I've never done it that way. So if I was gonna do that, I would just do gravity eliminated. So, and then fingers, flexion, extension. So I'm gonna try and push me away, but I'm not gonna let her. Now push back at my thumb, not gonna let her. So that's my isometric. And now I'm gonna say bring those fingers in, but I'm giving resistance, and now push me away, giving resistance. If you were working on strengthening with like a different option, I'll have some therapy putty out, those digiflexors we could use. I didn't grab any for the video, but otherwise you can just do the manual. So there you go.